imagine this for a second. Moving a cursor on your screen, maybe typing out an email, or even speaking, just by thinking about it.
Yeah, no hands, no voice, just thought into action.
Sounds like pure science fiction, doesn't it?
Okay.
But, well, today we're doing a deep dive into something real, the world of brain-computer interfaces, BCIs. And these are devices that really could, profoundly change the lives of people with disabilities, people who've lost the ability to move or even speak.
Absolutely. And for this deep dive, we're looking at a really interesting piece from NPR's Shots Health News.
Right.
And what it really highlights is how BCI tech isn't just, some lab experiment anymore. It's actually moving towards being a commercial reality.
So our mission today is really to give you that shortcut, help you get up to speed on this. We want to unpack how these things work, look at the history a bit.
It came from, and then the cutting edge stuff happening now, and really understand the potential impact.
It's easy to get caught up in the wow factor of the tech. But the why behind BCIs, the core reason, it's incredibly powerful, isn't it?
It really is. The whole field exists to solve this fundamental, often heartbreaking problem. It's about giving a new option, a new voice to people who are paralyzed.
Right, maybe from a spinal injury or conditions like ALS where they just can't move or speak anymore.
Exactly. The promise here, it's not just a small improvement, it's huge. We're literally talking about connecting the brain directly to a computer.
So you're taking the person's thought, their intention,
and turning it straight into action. It sort of bypasses the damaged nerves, offers a completely new pathway for control, for communication.
A pathway that just wasn't there before.
Right.
And what's really hitting home now is that after, more than 20 years of research in labs?
Yeah, long time.
We're at this tipping point. Companies are actually getting ready to bring BCIs to market, taking them out of the lab.
It's a major shift. Michael Major, he's the CEO of Precision Neuroscience. He put it really well. He said something like, "We know it works. We know the enabling technologies are now ready. It's time to turn this academic work into a thriving industry that can make a big impact on people's lives."
And it's not just one player. Neuralink, Elon Musk's company, gets a lot of headlines.
Sure, the most visible one probably.
But there are others, right? Like Precision Neuroscience, BlackRock Neurotech, Paradromics, Synchron.
Exactly. And some of these competitors, they actually have more years under their belt, or they're using tech that's maybe less invasive.
Which could mean an easier path through FDA approval. Less surgical risk.
Potentially, yeah. That's definitely part of the strategy for some.
Okay, so we've got the why, the huge potential impact. But how do they actually do it? What's the basic mechanism?
Okay, so fundamentally, you've got these surgically implanted devices, and their job is to detect and then decode signals right from the brain areas that control movement or speech.
So detecting and decoding.
Yeah. Think of it like this. You have tiny sensors picking up specific patterns of brain activity. Then an interface, like a small processor, figures out what those signals mean.
Okay.
And finally, an external device, like your computer or maybe a synthetic voice speaker, translates that decoded thought into the actual action.
So I think move the cursor left.
And the cursor moves left on the screen. Or you think of a word, and a synthetic voice says it. Neuralink even calls it, kind of provocatively, telepathy.
Right, that vision of connecting with loved ones, browsing the web, using only your thoughts.
Exactly. It paints a compelling picture.
It really does. And look, theory is one thing, but the real world stuff that hit home earlier this year with Nolan Darbaugh.
Ah, yes. The first Neuralink recipient.
Yeah, 29 years old, paralyzed from the shoulders down after a diving accident. He got the Neuralink device. What was involved in that?
Well, the procedure itself, it's pretty high-tech. A specialized robot threaded over 1,000 tiny electrodes into his motor cortex. That's the brain area for movement planning.
1,000. Wow.
Yeah. And then they installed a wireless interface about the size of a quarter, actually in his skull. So nothing visible outside.
And his reaction when he first used it, I remember seeing the video, he called it freaking wild.
He did. He said, when I first moved it, just by thinking, it blew my mind for like a day. I just could not wrap my head around it.
That just says it all, doesn't it? Going from paralysis to moving a cursor with a thought. It's got to be life-changing.
Absolutely transformative. And that video, I think it got something like 25 million views. Huge interest.
Now, it wasn't all smooth sailing, right? There was an issue.
There was. Some of those tiny electrode threads actually retracted slightly from the brain tissue. That made the device a bit less sensitive for him.
Okay.
But it's worth noting, Neuralink has learned from that, and they've implanted the device in, I think, at least 6 other people since then. So progress is being made.
Right. And, looking back, it feels like this is brand new, especially with Neuralink's robots and wireless tech. But the core idea, controlling a cursor with thought, it's actually been around for a while.
That's a really important point. It's not entirely new, no. You have to go back to 2004. Dr. Lee Hochberg and his team.
Ah, right, with Matt Nagel.
Exactly. Matt Nagel, living with paralysis. They demonstrated this. The tech back then was, well, different. Hochberg himself called them old-fashioned wires that passed through his skull.
So it literally wired from his brain to a computer.
Pretty much. But it worked. He could open an email just by thinking. Hochberg said even for them, watching it happen, there was a little bit of magic there.
A foundational moment.
Absolutely. Sadly, Matt Nagel passed away in 2007 from something unrelated, but his participation was crucial. It really paved the way.
And the progress since that 2004 experiment, it's just been phenomenal, hasn't it? I mean, monitoring way more neurons now.
Oh, yeah. We've gone from maybe a few dozen neurons back then to thousands now. The resolution is just vastly better.
And getting the data out. No more wires through the skull, right?
Right. That's a huge leap. We're talking wireless protocols now, connecting straight to a laptop or a tablet, not those, walls of computers they needed initially.
That changes everything for usability, for quality of life, taking it home.
Totally. It allows for independence, mobility in a way that just wasn't possible before.
And it's not just more data, it's smarter decoding too, right? Using AI.
Exactly. Scientists are getting much better at decoding the brain activity more accurately, more consistently, and more reliably. AI is key there, recognizing those complex patterns for speech or actions.
Makes sense.
And the field itself, it's also diversifying, specializing. You've got groups really focused just on decoding speech. Others are working on controlling robotic limbs.
Okay.
And some are even exploring how to put information back into the brain, which is a whole other fascinating area.
Oh, wow. Putting information back in, like a sense of touch.
Precisely. That leads us to sensory feedback. It's not just about seeing the robotic hand move. It's about feeling what it's doing.
Jennifer Collinger at the University of Pittsburgh really stressed how vital that is for fine motor control, right? Dexterity.
Absolutely. You need more than just visual feedback. Imagine being able to feel when an artificial finger touches something.
Or how tightly you're gripping a cup.
Exactly that.
Yeah.
Pitt has done amazing work here, often collaborating with BlackRock Neurotech. You might remember Nathan Copeland.
The guy who fist-bumped President Obama with a robotic arm, paralyzed after a car accident.
That's him. Famous moment back in 2016.
Yeah.
And he talked about this sensory feedback in an NPR interview a few years back. He said, with sensation, I could feel that the hand had made contact. I could also tell if I had a firm grip on it or not. That just highlights how important that sensory layer is for real-world use.
It really does. Makes it feel much more natural, I imagine.
Yeah, closes the loop. So while that sensory feedback is super exciting, the first commercial devices we'll likely see widely available, they'll probably focus on cursor control.
Building on that proven success from Nagel onwards.
Exactly. Start with what's most robust and build from there.
And we touched on the different companies. It's interesting seeing their different strategies for getting to market, like Precision Neuroscience, co-founded by someone from Neuralink, Ben Rappaport, and Michael Major.
Right. Their initial goal is that wireless device for controlling a smartphone or computer.
And they're thinking about practical uses.
Yeah, things like accessing news and entertainment, productivity software like Microsoft Office, Word, PowerPoint, Excel.
So improving quality of life, but also maybe enabling people to work again.
That's the vision. Major calls it quality of life enhancing, and it's also potentially enabling for people to go back to work.
And their key technical difference, the implant itself.
Yes, that's a big one. Their device is a thin film that sits on the surface of the brain. It doesn't penetrate deep into the tissue like Neuralink's threads do.
Ah, okay. So potentially safer, less invasive surgery.
That's the idea. Safer, maybe an easier road with the FDA because of the reduced risk profile.
And then there's Synchron's approach, which is even less invasive.
Totally different. They avoid opening the skull altogether.
Wow.
They deliver their electrodes through blood vessels.
Wow. Like a stent.
Exactly like stent technology.
Right.
Using those pathways to place the sensors near the right brain areas without major brain surgery. Really clever.
Wow. Okay, so different paths, different tech, but they all must face some common hurdles, right? Getting this out there commercially can't be easy.
No, definitely not. One huge challenge is just managing the data.
Too much data.
Yeah, think about it. Thousands of electrodes, sampling thousands of times every second. That's an enormous flood of data. Existing wireless tech kind of struggles with that volume.
So they need to compress it or process it somehow before sending?
Exactly. Lots of work going into data reduction and smart compression right on the device itself.
And then there's the cost. Clinical trials for FDA approval aren't cheap.
Not at all. We're talking potentially hundreds of millions of dollars per company to get through that rigorous process.
That's a serious barrier.
It is. But someone like Michael Major, at least, seems confident that the companies in the running have the resources, the capital, and the expertise to actually pull it off.
So, despite the hurdles, the feeling is optimistic. We're not looking at another 20 years.
No, the consensus seems to be much faster than that. Major suggested the timeline for marketable products might be more like another 2 or 3 years.
2 or 3 years. That's incredibly soon, relatively speaking.
It really is. Things are moving fast now.
Okay, so just to recap, we've covered this incredible journey of BCI tech. From those, early wired experiments, moving cursors.
Yeah, the Matt Magel era.
All the way to sophisticated wireless systems, AI-powered decoding, adding sensory feedback, even potential for speech.
And we've seen different companies taking different shots at it strategically.
It's this amazing mix of, long-term scientific groundwork and really cutting-edge, fast-paced innovation happening right now. A field that really feels like it's on the verge of changing so many lives.
Absolutely. We hope this deep dive has given you, the listener, a solid, quick understanding of where BCIs are today. It's not just cool tech. It's about expanding human potential in profound ways.
Yeah, and it makes you think, doesn't it? As BCIs create these totally new ways to interact, to communicate, maybe even allow people to rejoin the workforce. How does that change our definition of human capability, of connection? What does it mean when our thoughts can directly interface with the world through technology? What really stands out to you as you hear about all this, about the implications of this leap, something to ponder.